Hello, everyone, and welcome to the first ever SCORP podcast, a show by IFMSA-Pakistan and MSI India, where we dive into COVID and human rights. I'm your host, Maha Rahman, for this episode. Currently, I am a local council president. Previously, I served as regional assistant for Asia Pacific for 2 terms. And I was also serving IFMSA-Pakistan as National Officer of Human Rights and Peace. So, coming back to the podcast, you'll hear human rights enthusiasts discuss how COVID-19 pandemic has impacted fundamental human rights all over the world and the things that have learned along the way. In today's episode on ethics and human rights and health, our guests are Sahiba Manir from India, currently IFMSA Program Coordinator for Ethics and Human Rights and Health, and Alimzeb Khan from Pakistan, a member of SCORP national team. Welcome, Saiba and Alimzeb. How are you both doing?
Hello, everybody. I'm Sahiba Manyar. I'm from Mumbai, India. I'm in my final year of MBBS or your medicine career. Right now, I'm serving as the IFMSA Program Coordinator on Ethics and Human Rights and Health. I have also been the National Officer on Human Rights and Peace in MSAI India. I have been a part of 2 General Assemblies, and I was also the Vice Coordinator of GoScorp India. I've been a part of 9 IFMSA SWGs, and I think IFMSA is my hobby, including writing, speaking, dancing, and yeah, that's all. So nice to see all of you all here.
Thank you, Saiba. And I think IFMSA brings all together, writing, speaking, dancing, and whatnot.
Truly, truly.
Okay, moving to our next speaker, Alimzeb. Can you give us a brief introduction about you?
Yeah, hi everybody. Hey Maha. So my name is Alimzeb Hikmatyar Khan. I'm a third-year MBBS student in Saidu Medical College. I'm also the regional assistant for KPK2, the National Officer on Human Rights and Peace, coordinator for Saidu Medical College, and working pretty hard on the response team in SWAT. And I like poetry, and skateboarding is also a good time, and rapping as well. That's my free time.
I see you're doing some really fancy work with the government, Alimzeb. I really appreciate that.
Thank you, Maha.
You're welcome. Okay, so since our podcast is all about COVID and its impact, so I will start with how are you guys spending your time in this all restrictions, lockdown, somewhere curfews, and how are you doing? Like, how are you taking it? I start with Cyber.
Of course, life has changed a lot for the good and for the bad. It gave me a lot more time with my family, to know them better, to spend more time with them, playing small games with them at night, cooking, baking with them. Apart from that, lectures transformed from the classroom to the Zoom call, and the number of webinars increased. The one thing that I truly learned in this quarantine, in this lockdown, was never ever take anything for granted. And I know I never will, which includes going out with my friends or probably simply just walking down the street. Never going to take anything for granted from now on.
Yeah, that's really true. So that's a quite insightful answer. What about you, Alimzeb?
Hey, so spending time recently again, like with that same work. But now that I think about it, it's worrying for all of us, right? Like the restrictions that are imposed on us. I have my family back home in New Jersey, and New Jersey is pretty hard hit. So everyone's stuck inside of their houses, cooped up. Businesses are closed. Everything is kind of all over the place. And as far as I go, I've been doing my best to do whatever I can in SWAT, where I'm residing in my college. And as far as daily lives, I've gotten lazier. Some people have been exercising more. I've gotten a little bit lazier just sitting inside on my laptop. And that paranoia everyone has in the back of their minds. So, there's kind of like a little bit of an edge to everything now.
Yeah, I get it. Likewise for me, it's like, as both of you said, never take things for granted. But then I'm kind of enjoying this lockdown, staying with family, cooking, reflecting on yourself, giving yourself time because it's been long. I give myself some time. exercising, and then, yeah, again, cooking. So this sums up, and then little here and there, picking up some stuff, trying to do some volunteer work, and trying to keep myself busy. As ironic as it sounds, I really don't find any time to lay back and enjoy Netflix or something, because this lockdown, or like whatever the situation going outside, has kept me so busy that I don't even find time to talk to my friends. And then I don't know how, but it has kept me so busy. But yeah, I like it nevertheless. So, Saiba, what's your take on this? That if human rights are important for the pandemic response, are they? As you're the coordinator and you have been working on this task, so do you think that the pandemic is affecting human rights and protection, or are human rights important to the pandemic response? Does they both of them has a relation, or like it's vague as it sounds?
Of course, of course. Honestly, it's now or never. No one realized when this public health crisis became an economic and social crisis, and now a human rights crisis, all rolled into one. Along with that, civil wars, political tensions have put human rights on a greater watch than before. And the most important part is knowing that the lockdown and quarantine isn't the same for all of us like we all assumed. For some, it's just a matter of safety. For some, it's a matter of spending time with their family. For some, it's sacrificing their friends' time or their dinner parties. And for some, it's all about life and death. It's about getting food for their family or milk for their children or a roof over their head. People have been away from their homes, walking probably 2,000 kilometers all the way to their houses, migrants, workers. And I'm not only talking about people who are hyper privileged and underprivileged, I'm talking about every single person. There are loans, there are EMIs, there are school fees. For the first time ever, every single person is affected. You talk about women, you talk about men, children, youth, and older persons, refugees and migrants. You talk about people with disabilities, people in detentions, LGBTQ people, minorities. Every single person is affected, but just affected differently. And hence, right now is the time when we need to work. It's now or never. Because now, if we leave anyone behind, we'll be creating a gap of inequity which will always remain. And that is why I would say it's time to focus again on achieving the equitable, sustainable development and sustainable peace.
Yeah, that's really nice and insightful. And I love the how you put it out there with the relation of human rights. Thank you, Saib. Alamsef, do you think that human rights are as important as anything else in this pandemic response, or how the pandemic is affecting human rights in one way or another?
Yeah, surely. I mean, this is a crisis that hasn't been faced in 100 years to the degree it's seen now. And even 100 years ago, like, everybody knows we weren't nearly equipped then as we are now to face such a thing. And at its core, it's a global public health emergency that, we weren't prepared for. We have all of our plans, we have all of our systems almost ready in place for a crisis to fall into its lap and for it to activate. But, we fumbled with this one, and now the whole world is at its knees. And, our economic, social, and political lives are all affected. Economically, there's stimulus packages of trillions of dollars being put in devaluing currency. There's going to be inflation. Bitcoin has been fluctuating. Everything is just flip-flopping and turntabling. And politically, people are changing their stances because they're seeing, what do the politicians really care about? Do they care about their constituents, or do they care about the future of, the country's wealth? Do the banks matter more, or do the human lives matter more? And we're seeing in the U.S., over 105,000 deaths. I haven't checked it with the past 2-3 days, but you're seeing massive amounts of deaths everywhere. Brazil's heavily affected. We need to start being more careful in our normal lifetime. The priority is to save lives, and in the view of it, to preserve the life, countries have no choice but to adopt such extraordinary measures. But people aren't ready to face the reality of having to be stuck inside. And, we also see the human rights big issues still going on during a pandemic in the United States. So there's a lot going on. We just have to keep our eyes open, stay aware of everything, make sure we stay involved.
Yeah, that's really nice. And I love how you covered all parts of it. something or anything happens to the human, it in a positive way or in a negative way shakes the human rights. And I truly believe there is a quote that is out there that to each its own. Since for Pakistan, we are a developing country. For India, it kind of hits that developing part. It is kind of developed now. So, but even for that, we have a lot amount of people that are living under the bills that they cannot even afford the basic necessities, that is shelter, that is food, that is what you all say basic education. But then first for me it would be food, because food comes first and then just the next story. So I think that it has shaken everything. When there's lockdown, there were stories everywhere out there that okay, Pakistan has this lockdown and so many people they were out, like some were like begging on the streets. How would they do, because we have a labor population. So I think that there were a lot of issues like going there. But then I don't know how to relate it with the rights or the current situation, because to be honest, governments were doing their part of the story. They were to protect their people, because protection again is the first right. But then again, when you come to the protection part, you overgo some of like there are serious consequences, and we as nation face those consequences. Even now, we are facing some consequences. So the like it. I would end it like this: like everything is related with human rights, because of course, when there is human, there would be its rights. So, and then sometimes the rights are, the rights are taken care of, and sometimes you have to look to ulterior motives like saving lives than giving basic rights. That's a long debate in itself, but yeah, that's my 2 cents on the opinion. Um, Now, I'll say if this question would be for you. As the number of the COVID-19 cases increase exponentially each day, healthcare is being affected immensely. And how do you think ethics and human rights in health are being impacted as a result?
We can look at it from many different scales, right? So looking at it from the micro scale, we have the individual level, like me or you, for example. Do we have the capacity to report ourselves that we're suspected, that we can get a response team sent to us, that response team can take our swabs, get us our results within 1 or 2 days. If they need to, shift us to an isolation quarantine ward, high density unit, wherever you need to go. But we need to have that available for the people. We need to have everyone have the ability to go into a hospital or get themselves tested, or be able to be sure and lose that anxiety from the individual level. Because if we're all panicking as a whole collective, nothing is going to function. People will make bad decisions. Things are going to go awry. People will spend money on stupid things, or they just gather mass amounts of money and sit on it. Right? Jeff Bezos is almost the world's first trillionaire. That's amounts of money that is like 1,000 billions, right? That's an unnecessary amount of money. Nobody needs that much money, right? But anyways, regardless, aside from capitalism, but as the surge of patients presses on the hospitals, the resources of intensive care beds and mechanical ventilators are likely to be insufficient to treat all who may need them to have a chance at survival. This is where we need to be strategic. You have a district headquarters, you have a central headquarters. You shift all of your ventilators there. You have a massive high density unit. You have a screening unit. You have your own laboratory facilities. You have your own ambulances, your own SOPs, all of your own guidelines. If we try to manage it really well, from the paramedic to the health officers, the district health officers, to the federal Ministry of Health, right? We can have a system that creates a chain of accountability. I know I have to report this to this person. I know this person has to give me my equipment and my PPEs, etc. Are we going to let our own human rights be trampled upon in an emergency situation where we know there are funds available, we know there's things out there to help these healthcare workers who are having their rights impacted? And even going so farther as now so many businesses have closed. I'll give you the example of the US, which has been very heavily impacted, that I believe it was 15 to 17 million jobs have been lost, projected up to 22 million. That's massive. That's like, that's country crippling. Right? Like, what response is going to be put in place to keep everyone from falling on their faces and starving to death? Because it won't be a disease that kills us. It's going to be the collapse of the system and the collapse of food distribution. And like Maha was saying, if we don't have the food, that's just starvation, right? We're looking at like the beginning of the Chinese, the Chinese Communist Party, Mao Zedong's time, 50, 80 million people dying. 5 million people dying from starvation is massive. 100,000, 5,000, 1,000 people. The amount of deaths are staggering, and the ethics are not there, right? Look at the protests and whatnot. I can go on for days, and the healthcare workers that are being faced with dilemmas, I'll go on that last line. The healthcare workers don't need this additional pressure on them. We have triage systems that kind of take the weight off of the professionals. We need to make new structures in place that are keeping in mind, kind of shielding the mental health healthcare workers. We're not superheroes, right? I'm only a third-year medical student. I just started, going to the hospital this year to, take histories and watch the doctors ask questions and, observe and whatnot. But, I can see, it's hard to make those decisions. You have 20 people on a ventilator and you only have 15 ventilators. For example, 20 people need to be on and you only have 15 available. Who do you decide, right? The doctor makes that decision. It's not the patient's decision. The patient is unconscious. The morals, ethics, accountability, give them something to ride on. That's about that. Yeah.
Thank you, Alam Saif. That's a really nice answer. And yeah, that answered my questions really well. Saiba, since it's all about ethics and then you're the program coordinator, so who else to ask this question better than you yourself? How do you think that ethics in human rights and health are being impacted, or are they impacted or not impacted at all?
So, it's very important to understand that the people who we're calling our COVID warriors or our frontline workers, they're not just your specialists. They are your MD medicine specialists. They're your super specialists. And at the same time, they're your resident workers, your resident doctors. They're also your intern doctors. They're also currently your medical students in many, many parts of the world who are probably, risking their life and providing support to the healthcare facilities. Again, it's very important to understand that they're not just medicine specialists who are working. There are dermatologists, there are surgery professionals, there are ophthalmologists. Every single sector of the healthcare facility is trying and coming together to serve you at this moment. Again, the healthcare is not restricted to the hospitals. Healthcare is also taking place in different kind of quarantine shelters. Like in India, we have a lot of grounds that have been converted into quarantine facilities, or ICU specialists, and innumerable ventilators have been installed. But it's very important to understand that are all these health workers who we've involved, are they equipped? Are they trained? Are they capable of handling this situation? Are they capable of handling this kind of stress? And more than that, is our government providing them with, the PPEs or with protection for themselves so that they are safe? The numbers increasing every single day is not only revealing inadequacy in a loophole in the government. It's also talking about the inadequacy in the national government, the local government, the general population. It reflects upon all of us as a society, and that we need to understand as a whole. More than that, in health facilities, difficult decisions need to be taken at collective levels, at individual levels. It's about uncertainties and about the scarce resources, about which kind of treatment are we supposed to provide. This is the time when triage has become more important than ever. And to be very honest, the cultures we come from, especially when you talk about India, when you talk about Pakistan, triage is something which is very unheard, very unacceptable, and very incomprehensible for many. If you tell somebody that your father is 80, we do not feel the need to save him. We feel the need to use the ventilator for someone who is 40. It feels very ethical to me as a doctor, but it feels very wrong to me as a daughter. And that is something where culture also comes into place in the kind of treatment that we are providing. There are very important questions like, do elderly have specific roles in this kind of a scenario? Or what role does the government have? Or what does the general population do to ease the scenario? There is a very huge question mark, and the only thing that we have been told is to be at home. And that also seems very difficult for us to do. But there is a lot that the general population can do in this scenario. A very simple thing like probably, helping your elderly or helping a disabled person to get his grocery or to get his medicine is something that you as a general population can do. And I think that is a loophole that we need to understand, that we have created for ourselves, and the government can do nothing to help us in that. Apart from that, there has been a very unfortunate and steep rise of stigma and discrimination against doctors, against patients, against the other people who are working in the COVID crisis. We need to understand that these people are out there not because they want to, but because they have to. And that is one thing that our general population needs to understand, including you and me who are sitting at home. Apart from that, ensuring that protection of healthcare workers is there from the virus, and more importantly, from the society. And that is one thing that the government needs to take into action immediately.
Thank you, Saiba, for your answer. Now, I would like to say something about the question myself. For example, what is ethics basically? Ethics has some kind of pillars. I'll start from the patients. When we read ethics, or when we are taught about ethics, first one, whatever comes in mind is autonomy. But then here, when we are treating patients, such as in pandemics or like a stay we are in, for example, in COVID, there is no autonomy for the patients. We decide for them. It's not they're deciding for them. If we say that they're positive, and if we say that they have to be somewhere in this unit or that, they don't have a say on that. So we basically take their autonomy. Second is we are first, like when we're taking the oath, we say that non-maleficence. We will not harm the patients. But then, as you said, that we do triage in the hospitals because that is what the situation demands from us. And while doing triage, first thing that comes to our mind is prioritization, because living in the countries, even if we were not from India or Pakistan, even if we were from UK, but the thing is, or USA, the thing is that everywhere the resources are limited. So that considering that we have lack of ventilators, considering that we have lack of beds in the unit, or considering even if we do a lot, we still have to prioritize between people because again, we do not have resources. So then in one way or another, like I would think, I don't know if it's right, because if to every person their ethics are different. There are ethics stated like for what every person should obey, but then cultural impact or societal impact has a say on the ethics on what person believes. So for that, I would say that we are even taking the do not harm thing out too, because we deliberately will harm a person in order to save any other person that will survive. Then comes the confidentiality. Like we all know that in diseases like this, for example, we didn't face a pandemic before, but we were taught that if there are any diseases that spread with the like touch and the congenital, we have to report to the ministry. So again, the third pillar is taken. There is no confidentiality. And to be fair, yeah, doctors try to be fair. We try to do everything. Coming to the doctors part now, we are even there, even when the government or we know that there are no resources, again, there are no PPEs, but we will sacrifice our life for them, for the patients. But then again, are we doing any fairness to ourselves? Because first is like save yourself and then the patient. But then again, our ethical morals here hit again, and we jump into the situation because we are the saviors of the mankind. But what if we couldn't save that person, and okay, what if we save that person without going to the PPEs, wearing the PPEs, let's say, and then we get infected and we cannot save the rest of the lot that's waiting out for us to come back. So there are a lot of dilemmas, ethical, that we cannot, like, we're unsure about the situation. We are so uncertain that we forget what the wrong is and what the right is in order to save the lives. So I think it's just because of the time we didn't face it, we weren't prepared for it. And what we say in the disaster preparedness is a very important pillar. Like COVID is a disaster, kind of it turned into. But then since we weren't prepared, there is no wrong and no right. Everyone's doing its own. Everyone's trying to save their lives. Everyone's trying to jump into the situation without any protective measures and, like, again, saving lives. And then one last and important point I would like to say that with COVID, in India and Pakistan, we are very much attached to our families. Family bond is matters the most to us. It's the most important thing we have. And God forbid if we have someone in the family who got affected and they passed out. So what the thing? What do we want next? We would want their body back to us. But here we can't get the body back. And even with the body back, we cannot even approach the person. We cannot be with them when they're taking their last breath. So it kills us more than actually seeing the people dead or seeing the person who is dead. So again, but the doctors or the ministries cannot do anything because they're saving more people, and then there is the ulterior motive to it. But there is a breach of a lot of ethical issues. But then I would say that I think it's time that we are so uncertain. We're just trying to live through this time, and forgetting about what's right and what's wrong. But yeah, there is that. Now moving to the next phase, we have a kind of scenario for you both. I'll start with Alamsef first. Okay, Alamsef. So the scenario is a 12-year-old patient and a 78-year-old patient have COVID. They both require mechanical ventilation, but only one ventilator is available. The older patient is an infectious disease physician who has experience treating patients with COVID, and his research is in COVID-19 vaccine development. Who should get the ventilator?
Oh, so this is a pretty difficult. This almost goes to this goes to your ethics and perhaps your philosophy. But I would say also as a doctor, one of the key things to success, in my opinion, is objectivity. You do your decisions based off of logic. You don't do things just because someone developing the vaccine. It's a big thing, right? It's the vaccine development, and he's a very important physician. But let's look at the behind it, right? Let's find some logic. 77% of patients that go onto a ventilator don't actually get better. When they're in the acute respiratory phase of the infection, they're not going to get any better. They're actually going to get worse, and they're most likely going to die. And that's from data from the United States. And let's take that into account, right? A 12-year-old patient is most likely going to survive. Maybe they'll develop further complications in the future, but it's not our decision to be God, right? Our job is to save people's lives. The one who has the highest probability, we're not the ones to decide. Maybe he dies from a different condition before he, ends up finishing his vaccine, right? And you need to make agonizing decisions sometimes when you're faced with overwhelming demand and limited resources. You have to make those tough decisions, like Sahib was saying earlier about the triage system needing to be implemented, and you're mentioning it as well, Maha. What do we have to back us up? Why do we have to make these agonizing decisions based off of something subjective as of our relation to them, or etc.? At the end of the day, when you keep an objective and rational head, you keep the data in mind. Try to make it human, right? Obviously, try not to be a robot, just cutting people open,
Yeah.
feeding them medicines, and putting air in their lungs, right? It's about saving lives of being human and touching your patients at the same time, right? And so Italy appears to be facing shortages of ventilators and intensive care unit beds. I think personally they've gotten over their rut, but I'll give you from a personal view from SWAT here. Our central headquarters, we grabbed all the ventilators from the nearby districts. We didn't grab them, we requested it because it's the central headquarters. Our main unit is there. If they're patients, we send our teams out to them from the district health officer's office. We get their swabs, we treat them for free, everything. If we need to bring them in, we bring them into our own isolation unit. We have our own SEAL headquarters around the district, right? So using the resources you have to the best of your ability is what matters the most right now. There's a thing in Pushtu called jugaad, right? It's kind of like if you have something and you can't fix it with the tools at hand, you look around you and
For the shortcuts.
What do I have here? Yeah, what will get this job done for me? Yeah, exactly.
Yeah.
Okay, I need to get this job done to the best of my ability, but I don't have that available. And creative things are coming up. People are having making 3D printed tools, plastic tools that are making 1-volt ventilator into supporting 4 people. I don't understand the science behind it. I'm not going to tell you. That's a lot of complex stuff. But
But I get it. Like if
yeah.
I were to answer your question, I would say that I would just split the ventilator for, like if I can split it for into four people working, why would I have to make a choice? Because being doctors, making the choice is the most difficult thing, and it can, or like it of course does haunt you for a million years you will live, or whatever. Like a million is a stretch, of course, but for the years you will live, it will haunt you if you make the wrong choice, or even if you don't, because the things keep back hunting the mind again and again. And so I would just like making choices difficult, as you just said that like splitting is easy. So in this scenario based question, if I were to answer, I don't know what you would answer because I would come to you next, but if I were to answer, I would just say that I will just split the ventilator if that works, because I have heard, I didn't work in the COVID center yet, but I've heard that it does work splitting it.
Exactly. Like we need to be smart in these times and not mess
so
around.
Alam, who would you choose?
I mean, I think you know which direction I'm going to go. And it'd probably be the 12-year-old kid based off of like, as much rationale as I can muster up, You make the decision and you need to have a logic behind it. Otherwise, like you're saying, it'll haunt you for the rest of your life. A sound logic, to the best of your ability. So I would choose a 12-year-old kid, and I would, say goodbye to our old professor who was a great man.
Yeah, I get it. But if I give my opinion on this question, the thing is that it's so uncertain. We don't know about COVID yet. We didn't get a hold of this virus. It was acting differently in China. It acted differently in Europe. It acted differently in USA, and completely different in our countries. So we're not sure, because it can affect one person that's that age 82, like really mildly, and it can affect a 12-year guy really what do you say, like effectively. So like again, like it's such a difficult question. I don't know, like what the doctors went through by deciding such kind of job, because they're not sure who will survive. And like an old guy would survive and a young can die, or a young can survive, because it's not certain that the old are to die the most, because in our country we experience different things. We have heard about a lot of deaths of really young people. So that's really concerning. But yeah, we again, it's so uncertain that we cannot come to a conclusion. And yeah, we can of course just raise our voices or opinions out, but there's if we were in that situation, like God save us from that situation, then like God gives strength to the doctors who are making such decisions, and make the decisions right. That's only we can do, or pray, or do our parts, whatever we are doing, raising awareness or talking like this today. I have another question for you, Alamzeeb. It's kind of connected, but how can healthcare officials ethically decide who gets scarce medical resources and access to healthcare during this pandemic?
So I would say the priority should be the healthcare workers, the ones we call the frontline fighters, police, firefighters, other emergency workers, the army at the checkposts, the people, the plumbing people, water, electricity, other necessary systems, because that will save the lives of the others, right? Like maintaining that base of what we have of the food, water, resources. There's still going to be fires. There's still going to be heart attacks. There's still going to be criminals. There's still going to be drugs. There's still going to be every single thing out there that there was before. Slightly restricted again because the lockdown, and the level of restriction of the lockdown will determine the movements of everything again, right? There will be a decrease in car accidents. There will be a decrease in criminal activity. There will be a decrease in almost everything. Now, deciding who gets these scarce medical resources, that's something that's more of a difficult decision. But this needs like governments to make decisive decisions. They need to immediately step their foot in when something like this happens, assess it, put a plan in motion, and start tackling those specific sectors. If we don't have masks, talk to a company. I guarantee you, in a pandemic, they will allow you to take their blueprints and their technology and start producing and manufacturing yourself. There are the capabilities in every country to handle this, but what will be put forward? Will there be the sociological impact that the rich are thinking of, or the life and sociological impacts that the normal middle class and lower class and poor people are thinking of? what is going to be put in priority. The healthcare workers need their stuff, but the larger hospital needs more materials sectioned off to them than the smaller hospital would need. We need to go off of a logic that is clear to follow. A medical superintendent in one hospital won't be calling another and complaining and arguing. There won't be fighting and politics and drama, because everyone should have a base understanding of a logic. This isn't a normal situation. If you can't move yourself into gear and start production and movement yourself, then you should start thinking about imports. Already in Pakistan's National Action Plan for Coronavirus, made with the WHO, it mentions how import taxes for PPEs for doctors and etc. There's no customs tax, there's no GST. It's cleared from any taxes, and if you are a hospital administrator, you can order from outside the country without having a tax duty put on you if you reach out to the proper authorities, right? And traditionally, patients on ventilators aren't displaced for other patients, and later arriving patients can be turned away in shortage. I mean, it's an effort in and of itself to intubate a patient. It's an extremely high stress on the body just to intubate a patient and to maintain that position while they're spasming and coughing if you haven't given them any type of anesthetic or whatever treatments you're giving them. Because, when you take the intubation tube out of somebody, they could essentially just die right there too. You follow the treatment regimen through for that specific patient. If you can't handle the patient, it's the operator's job, the paramedics, to, while they're on the ambulance, right? This is just like from previous emergency operating systems in the US, that while you're on the ambulance, as soon as you pick up a patient, you reach out to the local hospitals, you radio into their operators, you say, do you have space in your hospital? Can you prep me a triage bay? Because it could be a car accident of a person that has coronavirus, right? You need to have double issues, right? You need a triage bed ready.
I get it. Yeah.
ICU ready, blah, blah, all these things. And you need to have PPE as well. And the first come, first served may disproportionately benefit the well-off. We know how it works in Pakistan. I've been here for like 2.5 years. In this subcontinent, right, the way that it works essentially is, if you know somebody, then you're going to let them do anything essentially a little bit easier, right? I guess it's an understandable thing. But this, again, isn't normal, right? We need to have it be a classical medical system the way it's supposed to be. The way it's supposed to be is no priority for anybody. It's everybody goes to the same place. If you want priority, if you're a government official, if you're an army official, you have your own establishments, make sure you have priority there. It's understandable. You want your commanders, you want your generals, you want your, politicians and these guys to stay alive. Even if it's a flimsy order, there's an order there, and nothing is like on fire and going crazy, right? So they need to maintain at least some form of whatever they're doing. But the healthcare workers across the country need to maintain their ethics and their own morals and keep it on themselves that I'm not going to prioritize anyone. I won't give anyone favors. This is something where all lives are equal.
Thank you, Alim. Likewise, Saiba, same goes for you. What would be your stance on this matter?
To be very honest, who actually decides who should be given a priority in treatment? Even when you consider a doctor does, which kind of a doctor decides who should be given priority? Whether priority should be given to a young COVID patient, priority should be given to an old COVID patient, or priority should be given to a COVID or a non-COVID patient. Today, the situation is not just restricted to COVID-19. There are innumerable other disorders all around, and it is not very unheard that hospitals have shut down their current ICUs, or including the ICCUs and the MICUs have been shut to make way for the COVID-19 patients. So the whole ethical question comes here to also ask this one very important question is, what about the other patients? Who are we to decide that COVID patients are more important than the other ICCU patients or the MICU patients? When we come back to the question which states about a 12-year-old patient and a 78-year-old patient, of course, we have noticed that the prognosis of a 12-year-old patient is better. They recover better. The fatalities are less. So definitely priority of treatment should be given to a 12-year-old patient over a 78-year-old patient. But how can we negate the fact that innumerable times, out of a very personal experience, we had a patient in our hospital. He was about 70 years old and a patient was about 25 years old and suffering different diseases, but we thought the 25-year-old would be saved and the 70-year-old would succumb. The next day we noticed that the the 25-year-old passed away and the 70-year-old was out of the ICU in the ward. So, are we really ethically correct when we're making decisions of even triaging? Yes, we are very well trained and we are very well, in these 5 years of MBBS and further on when we're taking a specialty, we are training ourselves to make these tough decisions. But we need to understand that science is also, the science of triaging is also a science of chance. And that is a risk that we have to take even when it comes up to ethics and human rights and health. It is inevitable, and that is a risk we have to take when it comes to a situation like this.
Yeah, I get it. But I don't know if like I might sound too rigid about it because after you both said what like who are we, but I have a different kind of perspective. I think that if not us, then who will decide? Because we are the front, like you say, we are the front force that is tackling the COVID or any other thing. Then, and we are responsible. We spend our lives studying about human body. And then, if not for the healthcare people, who would decide it? If not for us to do the triage or prioritization, of course, at times it turns out wrong because this is how we learn. As rigid, as rash, and as hard as it sounds, but we even like we learn on dead bodies. What would be more unethical than that? But then, if we do not make any decisions at the time, and if we do not learn about it, we have no one to say. And at this time of uncertainty, no one's sure about what's happening. We weren't like I was seeing some paragraph like this on social media, like we skipped this COVID disease in our pathology books when I do not even remember that this was in our pathology books. See? So like this was so unimportant. We are living in such uncertain times, but I strongly believe that healthcare professionals are the only one who are supposed to make any decisions because at this time let's say if we ask their families to make a decision for them, will be they able to make a right decision for them, for the society they're living in, for other people's safety? No, because we are the people who have to take that what you say the sour sip, and we are like as defenders, as the person responsible for it, as the most illiterate people. I wouldn't say most illiterate people because that sounds so discriminating. I appreciate all other fields, but yeah, as the people who are concerned at the point, I think that we are the only ones, and we should be the only ones to make the decision. So, as we're carrying on this discussion, Saiba, I would like you to say about if there is being a rises discrimination against healthcare workers due to this pandemic, because you were talking about that there is attack on the healthcare workers. Like healthcare was always in danger. I know that we emphasize this most in IFMSA meetings because if we see here or there are a lot of cases that arise. And recently, like you can even tell from your experience what happened in India recently when there was a lot of incidents and people were attacking healthcare.
So, coming from India, which is a developing nation with very, very, very high regards for doctors, I mean, I think every parent hopes that their child either becomes a doctor or an engineer. It's very mainstream. So, and unfortunately, in the past 3 months, I have heard devastating news. And it's not restricted to one place or one city or one hospital. It is rampant. And the healthcare workers are at the front line of any response. And they are unfortunately at the front line of the stigma and discrimination as well, because definitely they are at the front line of the virus. Across the world, there have been innumerable cases. This isn't a India, Pakistan, Bangladesh problem, or like the way we can say it, like a developing nation problem, or an Indian subcontinent problem, or an education-related problem. This is rampant. This is every single place. We could talk about a country like Japan, which is very, very developed. Some nurses were unwelcome in the restaurants which are near the hospitals and they normally visit. They are rejected by taxi drivers. In Philippines, we talk about Philippines where there are no PPEs that are available to the healthcare professionals, and they're not even allowed to travel public transports. When we spoke to the north of Philippines, she mentioned about People are walking 4 kilometers and more, and 4 kilometers is an average which a COVID warrior is walking, so that he or she could treat someone in the hospital. In the UK as well, people are evicted from their houses. How fair is this that a person leaves the comfort of their house to protect people like you and me, and are being treated absolutely like untouchables? Healthcare workers are experiencing a very sharp increase in racism as well, with people absolutely refusing to get treated for the same. If you notice, the disease was definitely found in Wuhan. So the disease went from being a Wuhan virus to an Asian virus, and it has just stuck up to being an Asian virus. Is it fair to treat us derogatory just because a virus was found in the subcontinent or the continent to which we belong? Since the coronavirus outbreak, there have been innumerable news reported that, about racism, about bias, about xenophobia, discrimination against people of Asian descent. And hence there is a reason that people have been insisting, including the WHO has been repeatedly insisting, that this needs to be called COVID-19 and not the Asian virus, or the Wuhan virus that people are referring to. And moreover, we have been always forgetting that frontline workers are not just our healthcare workers. They're not just doctors. They're also, the protective service workers, they're the grocery and the general store workers, your food manufacturing unit workers, bankers, government officials, janitors, maintenance workers, your plumbers, staff, agricultural workers, transport service workers. Can you actually imagine life without any of these? Imagine there is nobody in a medical store to give you medicine. Imagine there is nobody who is going to pick your trash up every day. Imagine there is nobody to clean your roads. Imagine there is nobody to give you vegetables every single day. Is it fair that we are going to treat these people in a derogatory way? Is it fair that we do not allow them to enter the buildings to which they belong? Is it fair that we tell them to leave their houses or not use public transport, or live in a place elsewhere? We've been neglecting the fact that they have been serving us in a time when no one wants to serve anybody. And apart from this, the recovered patients have been ill-treated. The family is ill-treated. They have been not allowed to enter their houses again. I know of a very personal scenario when the wife has contracted the virus, and the son and the husband has not contracted the virus, but the family has been told to leave, and they have been living in a hotel since the past 25 days till the time the woman or the mother is negative. Is it fair that in a scenario where they've already been suffering so much, they have outcasted them from the society and they are absolutely living on their own? The disease has escalated from being a fatal influenza to being a lifelong scarring psychological trauma, which seems normal, and that is the greater concern today.
Yeah, I totally I related to the topic. And what a pity when your own family turns against you. It's not like turning
Truly.
against, of course, they're saving themselves, but then it's, as you said, that it's a lifelong trauma, and nothing could have defined it more perfectly. Thank you, Saiba. Alam, same goes for you. What do you think? What is your opinion, or what's your take on this topic?
I mean, it's been there. There's always been hostility there. There's in certain regions have social knowledge to give different amounts of respect to different types of people. They'll just jump on you like they would anybody else when they don't really realize that you're actually saving their loved one's life, or maybe just save their life. It's like maybe the basic example I can give of I'm an EMT on an ambulance. We get a call for a heroin overdose. Go to the patient's house. Patient's overdosed on the floor. They're cyanotic. They're not breathing. And we start doing CPR. Then we give them intranasal naloxone. They wake up. They immediately wake up, right? Like once you revive them properly, and they'll shoot up, and you'll just they won't even appreciate anything because they're in their own high of that heroin. But people are in their own high of their life, and every sector has their own stigmas, right? Like there's the I think it's Kasai. I think it means butcher, and they call doctors butchers sometimes. I've heard that in Pakistan frequently, and I go to different villages occasionally. Obviously, no system is perfect, And obviously, this isn't like that type of thing where you're saying, don't do this and this won't happen, right? People will still blame you no matter what. People are still going to die no matter what. But the better we perform, the better we do. And the more of a humanistic approach we have towards our patient and give them as much respect as we want to receive from them, then maybe we'll see a difference as well, right? And the patients as well, having from a young age, a better understanding of treating the people, treating people in general, right? It comes down to a whole massive world, macro thing of macro sociology, where what is the whole society's opinion on it, and as well, with the whole China virus thing as well, like Saibo was saying, Asia virus, doctors of Chinese origin, doctors of Korean origin, Japanese, all of them, right? Laos, Myanmar, everybody, they're being discriminated against additionally now, even if they're doctors in the US, because of what it's being called, right? Now there's additional discrimination. Before there was a lot to worry about, and now there's even more to worry about. It's a tough situation, but doctors need increased security.
So again, I really appreciate your answers, and they're really informative. But I don't know, I think that I have taken this duty seriously today and bringing up the, harsh realities of the society and unleashing them. So because we live in a society which has numerous problems, what to take and what not to take. Here, there is a concept that basically doctors take normal patients and they say that they're infected with coronavirus. And there's this we as doctors are not even fighting with the disease, we are fighting with the mindsets of the people that we live with. We're fighting with illiteracy in our country because everyone comes with a different perspective. And if a doctor states to be polite and humble and states the facts, the other person brings out the bat and hit the doctor. So it's such a difficult situation. And even if it weren't for corona, there were, as Saiba said, that it's not for our subcontinent only, it's everywhere. If the person thinks that the doctor has done something wrong with their patient, they will just do whatever they have in their hand and they will hit the doctor. So I don't really get this thing where this comes from, because at this time when, as you both said, that we are risking our lives, we are going out there, we are treating the patients when even their family turned against them, then with what audacity actually they turn against us, or they hit us, or there's attack among them. But for the last thing, as Alam, you said that there's been discrimination. I don't know how even the doctors discriminate other doctors, because this is so weird. We doctors, the thing that always rhymes in my mind is that doctors without boundaries. We don't have any boundary. We feel connected because we have a community of doctors. How can we as a doctor discriminate with other doctors? Because recalling the past experience, there was a Chinese troop that came, like all of the doctors that came to Pakistan because they, of course, they overcome the disease and then they were coming here to help us out. And likewise, I think that China sent it to Russia and America too. But that's so, I don't know, that's so unreal and that's so inhumane to consider doctors as discriminating between doctors too. I don't know what times we're living in, but I hope this time gets over soon. Working at the front line imposes the greatest risk for certain groups of people, such as healthcare workers. So is adequate protective equipment being provided to healthcare workers? Is the government taking steps to protect the healthcare workers from it, or from being potentially exposed to the virus? Because of course, this is so important for the healthcare workers to protect themselves, because if they don't protect themselves, with what face we will tell the patients to come up with the mask, or to keep the whatever is recommended by WHO if we do not come up with that. With that, I will ask your opinions on this. Are governments deliberately kicking the healthcare workers into this deep, thick pit? Yeah, that sounded really dramatic, but as dramatic as it sounds, we're living in a kind of movie. This question goes for you, Saiba.
So, definitely, it is something very weird and something that we really need to think about. So, doctors and medical students have been asked to vacate their residential areas and forced to live in hospitals, hostels, hotels, quarantine centers that have been created. This is very common in UK, Myanmar, Philippines, India, Pakistan, and so many other countries. In India, the government did take action and finally made attacks on doctors and healthcare workers a non-bailable offense. In serious cases, gave invited a jail term of up to 7 years and a fine of up to 7 lakhs. But what about the others? And how long are we going to be able to find such people or report such cases? Apart from that, frontline health workers, 70% of them are women. They have long hours, long schedules, erratic timings, increasing risk of infections, burnouts. Are we giving them the equal status that we are giving the men in the field? The Italian Red Cross runs a hotline for healthcare workers seeking counseling. The UK doctors have been complaining the pressure on the healthcare workers that they've been speaking out. I've been reading innumerable cases in the newspapers in India itself and in many other countries where healthcare professionals have been speaking out about the lack of PPEs or the inadequate ventilator support or the government being incompetent in such cases, and they have been removed from their duty or not paid their fees. In a very prominent college, again in India, the resident doctors were forced to give their salary of a particular month to the government and in the CM Cares and the PM Cares Fund. Is it fair that people are already risking their lives and we are restricting the amount of money that we are giving them? Yes, money is not everything, but money is something that we all need. And it is a gratitude that you're giving to a doctor, and that is the least you can do. Deciding whether they give their funds to the PM Care Fund is not something that you need to do. It's something that they would do if they would wish to do. And their service is already something that they are providing to you. This is not restricted to the developing nations. In Italy, South Africa, Spain, US, many more countries, healthcare workers are facing shortage of protected equipments. And people in the community is making these equipments for them. So what are we doing as a society? What are we doing to our government? Are we asking them for an evaluation of the funding that we are providing to them? The whole thing is questionable.
Yeah, I get it. And then again, I like as you said that this is not even in some countries; it's all over the world. I had some friends in America that were working in the centers, and then because of the lack of PPEs, they were used to that the shoe comes in a kind of a polythene bag, so they were using that bags for the mask to protect themselves. So. I know that it is right to adapt yourself to certain situations, but then when it comes to risking your life, it's totally unacceptable. And I totally agree with you. Alamzee, what would be your take on this case?
The PPE are the fundamental, vest that we wear to protect ourselves against coronavirus. The face mask, the N95 respirator or N99 respirator, the gown and the foot covers, all that, the whole shebang, right? The government in certain areas, in certain places, are doing their best. You can look at Sindh and Pakistan as an example of a fairly positive response, doing things strictly, but doing things openly and organized, and getting a fairly good grip. But then you can look at other places like Lahore, and even in Islamabad, their hospital rooms are filling up all over the country. All the hospitals are struggling. More doctors are getting infected, which means they don't have the gear. But the main issue is we don't have the fundamental tools to deal with this issue, right? And the first tool is education. If I don't learn in medical school, right? I haven't learned this in my medical school. I learned this in in my training as an emergency medical technician and in hazardous material trainings, that N95 respirators need to be worn in a specific manner. They need to have full seal with the face. You can't have any facial hair, right? Maybe you can have very specific designs, and you can look them up on the internet and whatnot. But you can have very specific designs. Otherwise, it defeats the purpose of the mask. How would something filter 95% particulate matter if there's not a proper seal, right? According to researchers, when one wears an N95 mask it was with SARS patients in Singapore, and I think it was the 2003 outbreak. And the data showed that people who wore 3-ply masks had only a 69% positive chance of getting the virus, according to from the data they collected, right? An N95 mask, they had 91. They had a 91% protection against it. And sorry, for a 3-ply mask, by the way, it's 70% protection and 30% chance of getting it. And with an N95, it's 91% chance of protection and 9% of getting it, right? So there's not even a perfect layer of protection, but they need it. And how will they receive it if they're not being given it, right? It's a part of right to the health. The government should be creating the conditions that would assure all medical service and medical attention in the event of the sickness, right? So one thing regarding that is that besides just providing PPE, which is the first step, hospitals, for example, in Swat, we took control of one of the hotels nearby, the PTDC, and we set that up as a healthcare workers quarantine center. So the paramedics who just went out with a rapid response team finished their call. If they need to drop a patient off, drop them off to the hospital, they'd come back to the quarantine center. They would clean themselves up, decontaminate. They would check in. They would go to their own room separately, and then they would sit there and get a test, and then leave when they're cleared. And then they would go for their next shift or get a break if it's in their schedule. So we have some certain baseline of logic and protocol that we're following on a national level. But if we don't have the protective equipment, then that kind of defeats the whole purpose, right? Doctors are dying left and right. The DC of Balochistan just died recently, right? You can look in America. It's just a complete, crap show. FEMA is a great organization, right? The Federal Emergency Management Agency, but they weren't given the keys to the car. The whole point is when something is falling down, you prop it up with a specific tool. And a specific tool are national incident management system, communication plans, pushing things through together. But hopefully with production plans and factories being put in place for masks and PPE, we can push things forward to just providing it for ourselves. And again, there's NGOs that are helping us. WHO is also giving us oversight and assistance, but providing water. UNICEF provided big water tanks outside of our hospitals and in certain public areas. So there's a hand in here, but is the system built for its constituents? Again, this comes down to a whole society problem, right? Is a constituent built for the people, or is it built for the money to run and continue moving?
So as we're heading to the last part of it, I would like you both answer how, in your opinion, what measures should be adopted by the countries of the government or the governments to ensure the protection of healthcare workers. And with this, I would ask you individually, what's your take on this, and do you have any take-home messages, or would you like to say anything at the end? I'd like to start with Saiba, and how you think that government should be responsible and ensure the safety of the healthcare workers. And lastly, anything you would like to add at the end?
Definitely. I think first and foremost, and most importantly for everything, is education. Everything begins and ends by spreading awareness amongst the general population, because it is we who actually make a difference. And apart from that, for our government, it is very important for them to ensure that the facilities are clean, they have adequate and safe water, food, sanitation, hygiene. It is, there is a regular waste management that is being taken care about over there. Apart from that, the doctors or sanitation, hygiene. It is, there is a regular waste management that is being taken care about over there. Apart from that, the doctors or like I mentioned earlier, we're not just having MD medicine and super specialty people working over there. We also have interns, and now surprisingly we also have juniors who are working. So are they trained? It is very important to ensure that the people who are working in these centers have adequate training, and apart from that, very importantly, they have protected gear. India is known as the pharmacy of the world, but how much of that do we have for ourselves? We have been known to export all our PPEs and our HCQs, which is very good because we are helping globally in this crisis, but do we have enough for ourselves? Because we are the second most populous country in the world. So are we first adhering to our needs before we are distributing it to people all around? So definitely the country needs to think about many things like that. And we need to, more than anything, address to the attacks on the healthcare workers, the stigma and discrimination against all the frontline workers and the patients, and ensure there is adequate reporting of all these cases that is happening. More than that, in my parting statement, I would just say we make the society, and each one of us, whether it's you, me, the doctors, the patients, we are reflecting the current crisis. We are causing the rise and the fall, and we are people who are affected by it as well. So we need to address to each and every issue in our own ways, in our own capacity, and only then is everything going to come back to normal. Thank you so much.
Thank you, Saiba. Thank you so much. Alam, your take on this?
This is the time where everyone needs to step up to like the fullest of their abilities. If you're in a place where, like, if you're district health officer, ministry of health, whatever you're in, this is the time for everyone to start using their education to put it to the test. This is like what we've this is kind of something that's been in. We've known about pandemics, we've known about these diseases, and we've had this structure in place, like I had mentioned way earlier on. But were we ready to implement those structures? We weren't, right? I mean, we managed to come up with, I believe it was March 9th, Pakistan released that national action plan for coronavirus I was telling you about. It's like 119 pages or something, right? Going through it, it's fairly nice and it's fairly comprehensive, but inside of the actual document itself, on page 12, it says that it needs more plans to be developed, right? That means that we don't just stop at this one rung on the ladder that we climb. We grab the next one, which is developing another policy. We go for another one, which is upgrading this problem we noticed. We go another one up by getting more accountability. And once we have a structure in place and the government is ready and understanding, and it's not just the government, it's politicians and the presiding bodies that will be, enforcing these things or forcing us to understand in a way, it's actually the healthcare workers as well. Everyone is going to have to be flexible. Everyone is going to have to learn more. Everyone is going to have to test themselves and stress themselves out to the utmost of their ability to start mitigating this crisis. It shouldn't be going on for as long as it's going on, right? Like we could have had this under control with clear examples like China. I believe Thailand also has very good, a fairly decent lid on their cases, or I think it was Singapore actually, excuse me. But some countries are showing very clearly, right? We have our population diaspora of, for example, 44 million people in Canada, 330 million in America, the massive population of India, and the 220 million in Pakistan, India, et cetera, where we have different numbers will be different. Things will be more difficult when you have a higher density of population, right? But this is the point of the government, right? We have the data available, we have the knowledge, the resources, and the time. More importantly, we have the time. All you have to do now in a pandemic is to deal with the pandemic, not to start new initiatives and this and nonsense or this or that, or continuing to do the old, slow time wastage that was done. It's time for, if someone is inadequate in a position, you take them out of the position. Simple, right? I've even had this discussion with some of my superiors where we can't be softer this time. If somebody doesn't show up for their shift and they don't follow their protocols to go to the healthcare workers check center, we're going to cut him. We're going to cut them. We can't have a liability like that. In microbiology, the term is called a super spreader. You just need one person that spreads it to the other person. They can spread it up to a large limited population, right? We're trying to defeat this. We're trying to deal with this in the most strict manner possible. Every single person in society needs to be flexible, and the doctors and the politicians, governing bodies, are the ones that'll need to be the most flexible with each other.
Thank you so much, Alam, for your elaborative answer. At the end, I would like to say that I really enjoyed talking to you both, learning new concepts, and hearing you talk about what interests you the most and what's your perspective and what's your take on this. This was a really informative session for me too. I would thank you both, Saiba and Alanze, for taking our time and joining us for this episode. And to all the listeners out there, we hope you had an amazing experience tuning in today. Thanks for listening to this Corp podcast, and stay tuned for our next exciting episode coming up real soon. Until then, stay home, stay safe, and don't forget to like, share this episode, and subscribe to the channel for all the updates, crisp and cheap. Thank you so much.